We had a patient recently ask me, "Hey, Dr. Tam, one of my kids have bad breath. How do I fix this?" So today we're discussing a topic that affects many people, but can be difficult to talk about. It's bad breath. Whether it's just a one-time concern or recurring issue, it can affect your self-confidence and even your relationships. But here's the good news. If you or someone that you care about or love is struggling with bad breath, they're not alone. There are effective solutions, and that's exactly what we're going to cover today. And I have many patients who've come in, sometimes a little embarrassed, for them or their family, looking for that advice. But remember, there's nothing to be embarrassed about. It's a common issue with many people with multiple different causes. So let's take a deep dive into what actually causes bad breath and some lifestyle changes that you can do today to make a big difference, and treatments that can help you find relief. First, let's start with the causes of bad breath. We call it halitosis in the medical world. Now, there's several reasons why this might happen. Here are a few of the most common ones. Poor oral hygiene. One of the most frequent culprits. If you are not brushing and flossing thoroughly, food particles can remain in your mouth and decay over time, which can lead to unpleasant odors. Bacteria can also accumulate on your tongue, gums, and teeth, releasing sulfur compounds that don't smell very good. Dry mouth. Saliva plays a crucial role in keeping your mouth clean. It washes away food particles and bacteria. But if your mouth is too dry, often because of medications, dehydration, or even sleeping with your mouth open, those bacteria can now thrive. Diet choices. Certain foods like garlic, onions, spicy foods can contain volatile oils that can linger in our bloodstream and affect our breath long after we eat them. Coffee and alcohol can also contribute by causing dry mouth. Smoking and tobacco. Smoking, as you might guess, is a huge factor, and it can lead to dry mouth, gum disease, and also a lasting odor that is actually really hard to mask. Sometimes persistent bad breath can be a sign of something even more serious, like an infection in your throat, your mouth, your nose, or sinuses, or it can even be related to conditions like acid reflux, diabetes, kidney disease. Now that we've understand some of the main causes, let's look at what you can do to reduce or even prevent bad breath from becoming an issue in the first place. First, let's focus on daily oral hygiene. Now, this is one of the simplest and most effective ways to combat bad breath. Brushing twice a day with toothpaste, whitening toothpaste, mouthwash, using a toothpick. Be aware of scraping the tongue as well, as that's where a lot of the odor is trapped. Now, you gotta floss. Flossing helps remove the bits of food and bacteria that causes buildup between your teeth and gums, which can cause problems in the long run. Staying hydrated. Staying hydrated throughout the day helps keep your mouth moist and encourages saliva production. It's one of the easiest ways to naturally get rid of bad breath. Now, if you're struggling with dry mouth due to medication, talk with your doctor, see if there are any alternatives, or consider using sugar-free gums or other chewing gums to stimulate the saliva. There are certain foods, apples, carrots, celeries, can help scrub your teeth while you chew. They also increase saliva production. Did you know that? Which helps wash away food particles and bacteria. And maybe some mint-flavored gum can also be helpful as a quick fix. Sugar-free options are always the best. Now, avoid tobacco. Not only is it bad for your lungs, but smoking can lead to all world of difference in your breath, in your overall health. Not only does smoking dry out your mouth, but also leaves a distinct and lingering odor that can be very difficult to get rid of. While it's nearly impossible to avoid all odors causing foods, well, moderation can help. If you have an important event coming up, try to avoid garlic, onions, and spicy foods beforehand. Using a natural mouth deodorizer can also help. Now, if you try all these lifestyle changes and you're still experiencing persistent bad health, it might be a time to explore different options. Regular dental cleanings, a little feedback for all my dentists, right? A little pump for them. Professional cleanings can help get rid of plaque buildup and address any signs of gum disease that may contribute to bad breath. Need to find a good dentist? Let me know. Always good ideas to get dental checkups. Now, I'm not a dentist, but I recommend all my patients to come in, also to go in every 6 months, especially if they have ongoing concerns. Mouthwash and rinses. There's definitely natural mouthwash and rinses that gets rid of bacteria. I use one before every morning before I see patients, and also after lunch as well, to wash away everything that I've eaten during lunch. Now, mouthwashes are specifically designed to address bad breath, or speak to your dentist for more recommendations. If bad breath remains even after these steps, I always advise patients to consider consulting with their doctors, herbalists, holistic doctors to figure out what else it could be. Maybe there's something underlying, maybe linking to acid reflux or gastrointestinal issues, and treating the underlying causes will make a huge difference. A lot of our patients have bad gut bacteria. They're lacking probiotics, prebiotics, digestive enzymes. I mean, it could be anything. I hope this has given you a clear picture of how you can tackle bad breath and why it actually happens. I completely understand. It's very understandable to feel conscious about this issue. But please remember, it's very common and in most cases, very manageable. Your breath doesn't define you. I want you to remember that. And with simple changes and possibility, a little help from a professional, you can overcome this problem. If you have questions or would like to personalize advice about what we do and how we can help, reach out to us. My job is to get you healthier, better every single day so that you can live a healthier and more fulfilled life. Thank you so much for watching, and don't forget to subscribe for more health tips and answers to your questions. Take care, stay healthy, and until next time, keep smiling.